knee arthritis is mostly an age-related disease. Okay, so it's age-related degeneration of the joints. So when we talk about knee arthritis, so it is, sometimes you can call it, there is less greasing of the joint, or maybe the patients are not able to walk. So usually the patients, when they come to us, they bring symptoms. So symptoms are crepitus. So crepitus is joints make noises, creaking noises. They are not able to perform full range of motion of the joints. It is painful. If they avoid it for a very long time, then it causes joint becomes like this, crooked, you can call it. So mainly deformity, pain, and yes, unable to walk, unable to perform the daily living activities. First is age, which cannot be avoided. Okay. So the second thing is, if you have rheumatoid arthritis, you might have heard that, oh, I have arthritis, which is in blood. People are on medication since a very long time. It is rheumatoid arthritis. So patient who has rheumatoid arthritis, they are more prone to it. Okay, so one is this. Second is when you get infection of a joint. It is also known as septic arthritis. So those patients, those people are also very prone. Second is meniscus. You must have heard of meniscus injuries. Any sports player or any normal guy who has had meniscus injury in the knee. So if a normal age-related disease, if age-related arthritis is going to happen at 60 years of age, and if you have sustained a meniscus injury at around 30 years of age, then this person is more prone to get arthritis in early ages. Maybe it might be 45 or 50 years. So basically these patients, trauma, any infection of the joint, or maybe rheumatoid arthritis, so these people are more prone. So yes, risk factors are this. But the main risk factor is weight. So now we'll talk about risk factors which is not associated with any trauma or any disease. So lifestyle. Basically in lifestyle, weight. If your weight is more than 100 kgs, obviously it will put a lot of weight on your knees, right? While walking, it will put more load. More the load is, more the wear and tear of the joint will be. And arthritis will occur faster. So yes, weight control is very important. And other inflammation. So things which cause inflammation, all your sugars, all your refined sugar, basically. Junk food, basically, if we talk about. So these food causes inflammation in the body. So this inflammation directly or indirectly hampers the food cycle, the food thing which goes around in the stomach. And then there is inflammation in the joint, which causes cartilage damage, and then again arthritis. So these are the main things, the risk factors basically, which causes your knee arthritis. One is clinical diagnosis and one is radiological diagnosis. So in clinical diagnosis, whatever I said, that what we see in patient is the joint is making noise, patient has come with a deformity. So that is like, it is literally, you can see it. So that is your clinical diagnosis. Clinically, yeah, we know that this patient is having osteoarthritis. The other thing is radiological investigations. So on investigations, we can get an X-ray run, which is a basic modality. So in X-ray, we can see the joint space is already reduced. There is deformity. The straight knees have become crooked. So it is very much evident. And on MRI, it is advanced study. If we need it, then we get an MRI done. So it is both a clinical as well as a radiological. I'll name some arthritis names. So first is your osteoarthritis, which I have already spoken about. Second is rheumatoid arthritis. Third is septic arthritis. And there are many other types of arthritis. First is psoriatic arthritis. So you must have seen people with a lot of dandruff or eczema. So basically there is an inflammation going on in such people. So that inflammation can also occur in the joint, which causes arthritis later on. So one is that. Then the other thing is gouty arthritis, which is a crystal disease. So when kidneys are not functioning properly, then the crystals gets deposited into the knee joint. And then again, they causes inflammation, they cause cartilage damage, and then arthritis. The third is septic arthritis. Sepsis means infection. So if there is any ongoing infection in your knee joint, and if it gets cleared, even if though it gets cleared, it leaves behind some damage to the cartilage. and eventually after a few years, it will end up in arthritis. Again, there is one more example of trauma. I mentioned about meniscus. There are also fractures around the knee joint. So if you have been a trauma patient, like if there has been a trauma to the knee joint, that joint, even after operation, even after fixation with plates or anything, these patients are more prone to develop arthritis later on as compared to a normal individual. So these are the types of arthritis. So there are stages of knee arthritis: early, moderate, and late. So in early arthritis, what we prescribe is lifestyle modifications. So in lifestyle modifications, what we advise is not to sit cross-legged, not to use Indian washroom, because it causes deep flexion of the knee joint. So when there is deep flexion to the knee joint, there is more damage. And also we also prescribe some collagen supplements, which helps in healing of the joint. This is early. In moderate also, kind of similar treatment, but we also advise injectables. First injection is just hyaluronic acid injection, which is a bioviscous supplement. So as knee joint has little bit of greasy fluid, so we substitute that fluid with that hyaluronic acid. So that is one option. The other option is if the patient is having a lot of pain, we can also inject a steroid injection. And at late or advanced stages, the eventual treatment is knee replacement. So total knee replacement is the gold standard treatment and the last treatment. So it's not like, oh, it's the last stage, that's why we are getting knee replacement. No, but it is also the best treatment available. So that is in early stages. We can also do high tissue osteotomy. It's an operative procedure. I don't know if I'll be able to explain it to you or you'll be able to understand, but basically when the joint space is reduced, so we just make an incision, we cut the bone in that manner that we can increase the joint space so that bone doesn't rub on bone. So that is the treatment. But basically it's from conservative to operative. So in between conservative, we also advise lifestyle modifications. We can reduce weight, you can do some exercises, and eventually the end stage is knee replacement. In early or moderate stages, exercises, we also advise physiotherapy. In physiotherapy, what our main focus is to strengthen our quadriceps and our hamstrings muscle. So when we do that, they act as a dynamic stabilizers of the knee. So if for example, if your quadriceps and hamstrings are weak, so it puts more load on your knee joint. The more load it is, it's going to cause early arthritis. So to avoid that, we strengthen our muscles. If the muscles around your knee joint get strengthened, they will take offloading of the joint. They'll do that work, and knee will be little relaxed. It will feel relaxed, and then yes, we can delay the stage. So according to me, if you strengthen your quadriceps and hamstrings since the starting ages of your life, then it will really help you. There are going to be some genetic modifications in people who are genetically more prone to knee arthritis are going to get knee arthritis. That is first thing. But if you talk about us, like us being young, healthy individuals, and how we can avoid it or how we can delay it, is by exercising, eating healthy, and that's it. Avoid injuries to your knee joint. That is the main thing. Lifestyle modifications consist of only 3 things: exercise, weight reduction, and eating healthy.